The big picture view of the cosmetic dentistry would be is that we don't treat any patient the same. So in other words, there's a lot of different options that you have, whether it be veneers, which is partially covering a tooth, or whether it's crowns that's fully covering a tooth, whether it's tooth whitening, which is lightening your existing teeth. And I think with cosmetics, it's really important that you don't get stuck in thinking just about the now, but you really have to think about 10 years from now, 15 years from now, 20 years from now. So that something that I do now for somebody is still going to be relevant and is still going to look nice 10, 20 years down the line. I always stress to my patients when they come to see me that I recommend crowns or whatever we're going to do aesthetically, that we make it look as natural. It needs to look natural. It needs to look like a real tooth. My biggest compliment is when patients say, yeah, I saw somebody and they said, wow, you have a beautiful smile, you got really beautiful teeth. When in reality, these were all crowns. So not being able to pick a crown out, a lot of patients come to see me and are referred to me, sometimes even by other dentists, just to fix single anterior teeth. Because those are the most difficult ones to fix, so that you can match it up to the point to where when they smile, you can't pick out which one is the crown or the veneer. And that takes a lot of extra time. It also requires that you work with a high quality lab. And in our case, we work with, there's one ceramist that does all my ceramic. And what the ceramist is, that's the person who does the porcelain, your lab technician. I only have one. There's one person who does all mine. So as a result, I've developed a pretty, good relationship with them, so they know what I want. I'll actually go to the lab sometimes and work with them, because I did a lot of lab work when I was in dental school. I used to do lab work for dentists out in private practice while I was in dental school. So that's been nice, having that connection. So aesthetic-wise, the biggest things that you look for is symmetry. One side mirroring the other side. Making sure that when they smile, the line of their smile goes with their face. In other words, we're not symmetrical. Nobody is the same. If you really split somebody's face down the middle, you're always going to find there's a difference between the left and the right side. Maybe your eyes are slightly higher on one side than the other, ears. And so it's taking all those things into account so that the smile fits to the face. I always tell patients that their face is the frame for their teeth. You got the frame, now you have to fit the picture inside so that it works with the frame. And by that I mean someone who's very fair and blue eyes, they can have a much lighter tooth and have it look totally fine for them, versus someone who has an olive complexion, darker eyes. You put that same light tooth in their mouth, it's going to create so much contrast that it tends to almost look artificial. That doesn't mean that someone can't have really white teeth, but those are just some of the things that you take into account when you're doing cosmetics and aesthetics for people, is making sure that it goes with their face, size appropriate, shade appropriate, and that it flows and it follows the lip line. There's many things that you kind of look for. It's not just about plugging a crown in there or plugging several teeth in there. You want to make sure you need to look at the big picture and how that's going to flow and what that's going to look like, and also the long picture. How is that going to look 10, 15, 20 years from now? So that they're not somebody that's going to invest a lot of money in making their smile, and then all of a sudden 5 or 10 years from now they're not happy with it. So that's one of the things that you need to take into account.